Hello and welcome to this week's IRQTC Training Tips newsletter. I'm Brian Traskos, founder and director of the Institute for Rehabilitative Qigong and Tai Chi. This week we're going to explore another way to look at postural correction. And we're going to look at this through touch. Now I understand that there are other Tai Chi teacher training programs that advocate no touch policies. And while I completely respect and understand these policies, at the same time I know that the modality of touch is a powerful way to convey knowledge from a teacher's experience into the somatic experience of their student, their patient, or their client. So with that said, before we do any touching in any of our IRQTC programs, and I highly recommend in any of your programs as well that you do with people, that we have at least two things exist. Number one, it has to be legally appropriate for us to do the touching. So that's number one. And number two, we receive verbal agreement from the student, client, patient, whomever in order to do the touching. And that's simply in a manner of, hey, may I touch you? We get a verbal response, and then we can move forward with our physical contact. So those two things must be in play before we can utilize these modalities really effectively. Now, why touch? Well, touch is actually our primal sense. It's the sense that we experience first in utero. And partly because the skin and the brain actually arise both from the ectoderm, which is the same embryological layer. We might think that we might conceive of it in that the skin is the outer covering of the brain, or that the brain is the deepest layer of the skin. And either way you look at this, there's a connectivity between these two structures, that our brain receives primal input from our skin to make all manner of corrections towards our environment for all kinds of different purposes, whether it be survival or health or what have you. But there we go. Touch is so powerful in that effect. Now, of course, underlying the skin, immediately underlying the skin, is our connective tissue. And our connective tissue, if you have taken our fundamentals of Rehabilitative Qigong Tai Chi program, you'll know all about the connective tissue and its properties on a very profound and deep level. But let's just review it really quickly. The connective tissue is crystalline in nature. Because it's crystalline in nature, it can propagate piezoelectric phenomenon, or electricity. Now, this electricity actually informs body systems to perform certain functions. Okay, so that's where we are there. And the crystalline nature of our tissues translates or spreads or moves this piezoelectric information when the body is moved in some way, when there's some type of physical deformation that takes place. Now, how does this work from practitioner to client or patient or student? It's very similar to how actually horseback riders function with their horses. Now, in my teaching and traveling, I've had the great pleasure of speaking with many hippotherapists or equine therapists that work with therapeutic riding programs. And what these therapists consistently tell me is that when there's a rider on the back of a horse, when the horse and the rider are in tune, and the horse is really sensitive and tuned into the rider on its back, that when a rider just looks in a certain direction, that the horse will go that way without any verbal commands. Now, how is that possible? Well, basically, when we look in a certain direction, we have shifts in our body postures, which changes the piezoelectric phenomenon in our bodies. Now, those body shifts, those posture changes, are felt by the horse. Now, when you're on the horse can feel that in the horse's system, and then the horse translates its movement based on the visual scanning of the rider. Now, there's no mental telepathy going on there. It's all done through sensation. So in essence, the horseback rider's body shifts and change are, of course, producing piezoelectric phenomenon inside of the rider. But since the rider's connective tissue system is connected to the horse's connective tissue system, even if it's through the saddle or some type of support device, the horse is still picking up that information and making automatic corrections based on those weight shifts. It's happening below the level of conscious awareness, and therefore no verbal commands are needed to do so. So when we think about correcting our own students and patients and clients, we can utilize the same phenomenon. So to help me today is my friend Carol. So Carol, can you come on over here and help me today? So Carol's going to be our patient, client, student today, and I'm going to play the role of therapist. So many times when we want to think about correcting posture in our clients or our students or our patients, it's that slumped posture that very often we are looking to correct. We can have you turn sideways, actually, Carol, this way. And very often we utilize what we call force. And this is where I like to talk about force versus power, power versus force. And often we take our hands and place them on either side of our patient, student, client, and we do this. We try to actually, you can relax for a second here, we do that type of motion where we bring the back in and we bring the chest up and we're trying to correct in this way. Now that's a forceful correction. And we know that the muscle tonus that underlies the skin changes its activity based on skin pressure, whether it's lighter or heavy, and also on direction of push. So very often when we push our subjects, what they will tend to do reflexively is push back into us. So when we do these types of corrections and we do a push correction, a lot of times what happens is we get a reflexive push back into the force that we're applying into our student, client, or patient. And over time, this will simply perpetuate the posture that we're looking to correct. So what's a powerful postural correction look like rather than a forceful correction? Can I just turn to the front now, Carol? In a powerful correction, we as therapists or teachers, we correct within ourselves first. For whatever correction we would like to imbue into our student, patient, client, we first correct within ourselves. So if we want to bring towards our experience a more upright posture, then it's my job to relax my knees, settle my tail, lift my head, and then lightly connect to my client. Now, once we're lightly connected, I once again sink the tail, lift the head, and naturally my hands follow my body. That's a Tai Chi rule. Hands are following the body. As my tail is sinking, my head is rising, hands are following. And now the correction looks like this rather than this. Okay? So now we have a lengthening going on. Can we have it turn to face the other way, Carol? So from just a behind view, my front hand is going to go on the sternum, which you won't be able to see. But before I do that, tail is settled, head is lifted. I'm imagining within myself this long, tall correction. Contact and contact. And then once again, do my correction internally, sinking and rising, extending upward. You could also potentially do this with a hand here and here, and again, also extending upward. And this actually works even a little bit better in sitting. It's a little safer for our shoulder to do it in that way. So let's go ahead and sit down, Carol. So if we have Carol sitting and we want to do the same sort of postural correction, we just align ourselves, sink the tail, lift the head, gentle touch below, gentle touch on the sternum, and then sink and rise, extending both above and below, and gently translating that information into our client's body, below their level of conscious awareness, working directly into the connective tissue system. So next time that you are interested in correcting posture for someone, take just a moment, slow down for a second, realign yourself, and then bring yourself to that client with the expectation of what you'd like them to be able to do is already occurring within yourself. Thanks so much for joining us again this week for this IRQTC Training Tips newsletter. Check out the Fundamentals of Rehabilitative Qigong and Tai Chi program where we go deep into the science of why these things work. And also remember that our Balance Enhancement Specialist Training specializes in using these hands-on techniques for corrections of all sorts with our clients, especially to enhance balance. Thank you so much. Have a great week. Bye-bye.